The gastroc stretch begins by standing with the leg that you are trying to stretch in back with the knee straight and the heel out and toes turned slightly in. The other leg is in front and slightly bent, keeping the heel of the back leg on the floor as you lean forward into the wall. You should feel a stretch in the back of the calf. As you lean forward, make sure to keep the heel of the back leg on the floor and keep the knee straight. To stretch the front hip and thigh in a standing position, use a counter or chair for upper extremity support. Pull the right heel towards the buttocks while keeping the buttocks tucked underneath. Pull the knees backwards to feel a stretch in the front of the thigh. Do not pull the knees apart. Start wall squats by standing with your back against the wall. Place your feet 12 to 18 inches away from the wall with the feet hip width apart. Lower yourself to a seated squat position so that the thighs are horizontal. Slowly slide back up, making sure that you maintain contact with the wall with your back and buttocks area. To decrease the difficulty, you may try a semi-squat by not sitting quite so low. Make sure to keep your weight back on your heels and push through your heel rather than your toes as you come up. To perform heel and toe raises, begin in a standing position. Use a chair or a counter if needed. Rise up onto the balls of your feet while holding onto the chair or counter. Slowly lower yourself down. Then rock back onto the heels and pull your toes up. Keep your knees straight. Alternate back and forth between rising onto the ball of your feet and onto the heels. To make the exercise more difficult, you may lift the hands away so you do not use your upper extremities to assist with balance. Alternate back and forth between rising on the ball of your feet and onto the heels. To perform this exercise, begin in a sitting position. Initiate head rotation back and forth. Continue to rotate the head back and forth as you stand up. Continue to turn the head back and forth and sit back down. Repeat this movement of sit to stand while continuing head rotation. Then begin nodding your head up and down and continue with performing sit to stand movement. Remember to continuously move the head up and down as you continue to transition from sit to standing and standing to sitting. Begin this balance exercise by standing on one leg and begin rotating your head side to side, keeping your eyes open. Then begin nodding your head up and down, keeping your eyes open. You may stand next to a surface you can use for support if needed, such as a sturdy chair or a counter. Make sure that you keep your hands close enough to the surface that you can quickly reach the support surface if you become unsteady.
Check with your doctor or therapist before performing any exercises or stretching to be sure these exercises are within your ability. Be sure to understand the correct technique before performing any exercises. Should you experience any pain while performing any exercise, stop immediately.